Hi there, my name is Eric, a trainer in applied biology at the Kenya School of TVET. I want to talk on an issue called endocrinology, particularly the abuse of the youth hormone. The youth hormone is generally very much abused. Technically, it's called the testosterone hormone. This hormone is abused by bodybuilders, those guys in gyms, so that they can be able to build muscles. They use the testosterone hormone. This testosterone hormone use completely disrupts the homeostasis of our system, making sure testosterone is one, reproduction hormone. Two, it makes sure you have the secondary sexual characteristics. So, for example, for you to have an, a, an erection as a man, you need a good quantity of the testosterone hormone. For you, for you to maintain your erection, the testosterone hormone has to be continuously produced by the the two balls, or the testes. They have to continue producing the testosterone hormone. When you inject it into your system as a steroid, most of these steroids do not, they only imitate testosterone as a hormone. They imitate its physical, secondary physical characteristics, and they forget about the sexual characteristics. That's why you will find in many common people would say those people who go to the gym, they have a small penis, they are not active in bed. That's because of the abuse of testosterone hormone. Secondly, the abuse of this hormone is very common amongst these young people when the body is developing. So, if you have a lot of testosterone, a lot of steroids in your system that mimics the testosterone, the normal testosterone, the body does not produce the testosterone. The brain acts as some. The brain assumes you have a lot of testosterone in your blood, you don't need any more. So its production ceases. So you have to maintain the steroids that do not perform the sexual function. So when it comes to bed-related matters, those people who are abusing this, who are using these steroids, will have a disadvantage just because of gaining muscles and perform. If you're not competing, you should not gain muscles. And if you are engaging in competitive bodybuilding, please look for an endocrinologist. Look for a professional, so that after taking this testosterone, there are drugs. And the biggest disadvantage of testosterone is testosterone has some psychiatric behaviors. That's why you'll see some cows acting, some bulls are acting in a psychiatric manner. So those people who abuse hormones, for instance, the case of it, the huge wrestler was called Chris Benoit. Chris Benoit, it was Chris Benoit, depending on how you mention it, was a classical case of abuse of testosterone. He killed his wife and his child, and later on killed himself. Abuse of testosterone, abuse of the youth hormone is dangerous for your health. Thank you. Please continue follow my YouTube channel. I'm Eric Mushoki. I'm a trainer in applied biology at the Kenya School of TVET. Thank you for listening.